Hello and welcome to Samavesh. This video is about physiotherapy and it is in the continuation of the series all about therapies. So now let us understand what is physiotherapy. In physiotherapy, what happens is that all the physical aspects of the body is taken care of. A person is made comfortable with his own body. And when do we need physiotherapy? Suppose if somebody is having any developmental issue, some child is having some developmental issue, body is not functioning, the body is not functioning as per the requirement, then the physiotherapy will be needed. Also, if suppose there is some injury in the body, and in that case like the physical body parts are not working properly, in that case also physiotherapy helps in training the person to make complete use of their own body. Okay, now how does it helps the children with ADHD and autism or with cerebral palsy? See, what happens is when such condition is there, let's leave cerebral palsy aside for a while because that is altogether a different case. If let's consider ADHD and autism. In that case, already there is a lot of the body is already out of sync. The brain is out of the sync, and there are like lot of issues happening in the body. Depending on person to person, those issues can be unique as well. So what happens? There may be some developmental issues. There may be some low muscle tone. Or the body can be weaker than what it is expected according to the age. Like for example, if you observe a child who is having autism, they are more prone to have flat foot. Now flat foot is like the foot will be flat, it will be not be having a curve, but it will cause a lot of problem for child to keep the balance while they walk or they run. So in that case also the therapist can suggest you the physiotherapeutic shoes and all, which will help the child to recover from that thing, and which will again help in making the balance of the body. Okay, so these kind of things are there in such children, and then physiotherapy can be really helpful. Now, the next question which comes into our mind, do all the children who are having autism or ADHD will need physiotherapy? No, that is not true. There are a few kids who will not at all need any physiotherapy because physically they will be doing fine, and whatever thing is a lack will be already covered in the occupational therapy. So they will not need physiotherapy. But if you there will be few children, they will have like major physical delays. In that case, definitely physiotherapy can help a lot. But now, how you will recognize whether your child needs physiotherapy or not? First thing and the foremost thing which you should do is that you can, depending on the child's age, you can go and search on Google and see what are all the physical milestones the child should have achieved by that age. So by that you will come to know that what are all the things the child is not able to do, or even if the child is doing, he is not doing up to the level of his age. Okay, so by this you can make out. Second thing is that by observing in day-to-day activities, suppose if the child is not walking in the way that there is a difference in the walk, there's a little difference from that normal walk, so that we can clearly make out if the child is leaning towards a particular side. So those all things we can make out. If we are seeing the child is doing everything perfectly fine, but while doing few activities in which the whole body is involved, the child is not able to coordinate the different body parts, those kind of issues are coming. So that basic observation we can make at home, and then see, after doing the basic observation, definitely we are not the physiotherapists, we cannot do complete assessment. The best way is to go to, if you have slightest doubt, you feel like yeah, there may be a physical issue, that thing you can make out at home. After that, the next step should be that you should take a physiotherapist assessment. Once the physiotherapist assessment is done, you have to ask like what are all the issues you are seeing in the child. is that how much physiotherapy the child will be needing. So depending on the what response the physiotherapist is giving, you can make a call. See if there is like lot of physical issues, the child is not walking properly, not sitting properly, a lot of things are there. So in that case, an exhaustive physiotherapy will be needed. But suppose if the child is having only minor issues, like the strength is weak, and the balance is weak, or like flat foot is there, so that you can do along with the occupational therapy. Occupational therapists are also aware about the physical aspect of the body, and they will be also suggesting a lot of activities. So you can just go and talk to the occupational therapist where you're already going, and tell that, okay, I took this physiotherapy assessment and I feel that these are the things where my child is lacking. Can we take care of those in occupational therapy as well? If the occupational therapy is okay, or if whatever the occupational therapist suggests, say that maybe I'll not able to do it, or whatever he or she is suggesting, depending on that you can take the next call. But generally what will happen, they will cover that part, because already we are going we are taking so much therapies. Occupational therapy, we are taking speech therapy, then few kids will be going for behavioral therapies also. I mean, this much therapy, and then one more physiotherapy we are putting on head of the child. So that will not be good. It's better to talk to the occupational therapist only, and then main our objective is to remove that issue. It's not like where we are going. So that identification part, for that definitely we will be needing the help of physiotherapist. After that we can take the help of occupational therapist. In the same session he can like take 15 minutes for the physical part as well. Then other thing which I want to mention here, that as a parent what we should do. First and the foremost thing which we have to do is that we have to make a note of all the issues the child is having. So you should have an diary, which I always tell you that have a diary, but you should have a diary, and in that you should mention all the physical issues the child is having, like the core strength is weak, the muscle tone is low, and that coordination is low. Whatever you feel, whatever the therapist is telling that these are the issues in the child, you have to make note of it. Then the next thing will be that what are the activities you are doing and which are areas you are covering. Suppose there are a lot of issues, lot of physical issues, in one go you cannot do everything, right? So you have to take like okay, right now this is where we start, these are the things where we have to start, and these are all the exercises or the activities which we will be doing for the child. So you will make note of it, and then focus on those particular aspects and see how the child is improving. Okay. And even if you are not going regularly and you're like taking it in the OT therapy only, just try to go to a physiotherapist for assessment, maybe once in 3 months or once in 6 months, but just go and see. Okay. Other thing which I would like to mention is that physiotherapy has been proven to be helpful for physical aspect of anyone. So we should not be scared whether the therapy will work or not, or this thing or that thing. No, there is no need to be scared. It's just a basic exercises which the child has to do, and which will help in strengthening the body, in helping the body to coordinate better. So we should not be scared that they will be doing something this or that, or extra burden will come on the child. No, it's just like an exercise, and depending on your child's level you have to do it. It's not like even if your child is not able to do, you are like forcing the child. That will not work. That can cause like sprain or something like that. So don't do like that. Just do it lightly. 15-20 seconds ka exercise you can do aram se at home also. And it's very important to learn the therapy for home as well, because suppose if you are not able to go to the center, and something is there at home and you are not able to, you are traveling somewhere, in that case you can do it at least along with your child. So it's very important to learn as well and do it regularly. It's just like going to the gym. If you go to the gym regularly, you will lose weight. If you don't go, you will not lose weight. Okay. So it's just like that. And other question which comes to our mind, that how long we have to do. See, it really depends on the issue the physical issues the person is having. If it is a minor issue, 1 month 2 months you will be done with it. But if there are major issues, especially in the case of the children, because if a developmental delay is there, the child doesn't know jumping, so within a 2 months 3 months the child may start jumping, but it will be like the child will not have that proficiency. Our goal will be like to make the child move towards the perfect. So we will have to give him more and more practice for more number of months. Okay, but within a month definitely you will see a few changes. Like if the child is bending too much, after doing the therapy you will feel that okay, the child is sitting erect and all. Okay, so this is what I wanted. And yes, as in cerebral palsy it is altogether a different case, and in that case physiotherapy becomes very 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 important. There is a lot of muscle exercises which the physiotherapist will be doing, and it has to be done regularly for a lot of years actually, because cerebral palsy, that is the basic issue which the child faces. So we have to do it for years and years, and if we maintain a continuity, it definitely helps the child a lot. Okay. And whenever going for physiotherapy, just don't be scared, don't be like uh, what they will do, they will put some machines or something. It's nothing like that. For kids it's like basic exercises, few weights or something they might provide, but that is just like depending on the child level only they will give. Okay, so there is no need to be scared, and you can go ahead with that. It is a proven therapy for improvement in the physical aspect, so trust it and go along with it. Okay, see you in the next video. Bye.